Next, the factors enhancing warfarin effects like debility, malnutrition, liver disease for newborn babies, prolonged antibiotic therapy. The factor decreasing the warfarin effect is like pregnancy, nephrotic syndrome, genetic warfarin resistance, and the drugs enhancing the anticoagulant actions, broad spectrum antibiotics, aspirin, which are mainly platelet aggregation inhibition and hypoprothrombic action, newer cephalosporins, etc. And the drug reducing effects like barbiturates, carbamazepine, etc., rifamycin, etc. Next is antiplatelet drugs. Antiplatelet drugs are which interferes with platelet functions, and these are useful in prophylaxis of thromboembolic disorders. Okay, so antiplatelet drugs, these are the drugs which interfere with platelet functions, and these are useful in prophylaxis of thromboembolic disorders. Drugs like aspirin, dipyridamole, ticlodipine, clopidogrel, etc. Aspirin as antiplatelet drugs. This is an irreversible inhibition. This mainly acts as a irreversible inhibition of COX-1 and TX synthase, which by inactivating them irreversibly. So irreversibly, and aspirin inhibits the COX-1 and TX synthase, and this is also suppress the TXA2, which is generated by platelets in low doses till the fresh platelets are formed, prolonged bleeding time. This also suppress the COX-1 and decrease the PGI2 synthesis in vessel wall. But endothelial cells immediately resynthesize fresh enzyme. This also inhibits release of ADP from platelets, and they are sticking to each other but not to addition to damaged vessel walls. The drugs, antithrombotic drugs like dipyridamole, this is a powerful coronary dilator which increases the total coronary flow. By which action this worked, like mode of action is what, or mechanism of action is what? Adenosine is a local mediator involved in autoregulation of coronary flow in response to ischemia. Dipyridamole prevents uptake of degradation of adenosine and decrease the platelet CAMP, which potentiates the PGI2, which interferes platelet aggregations. So uses of dipyridamole is enhance antiplatelet action of aspirins. There is also a drug ticlopidine, ticlodipine. First, thienopyridine derivatives, which is a prodrug active metabolites in liver. Mode of actions of ticlopidine is what? Inhibitions or it inhibits the fibrinogen as well as ADP induced platelet aggregations. What is the uses? Stroke preventions, intermittent claudication, unstable angina, coronary bypass, prevention of myocardial infarction. And what are the adverse drug reaction of ticlopidine? Bleeding. Almost all anticoagulants, which adverse reaction is a severe bleeding, because it the uses of anticoagulants are restrict the coagulation. So if coagulation restricts, or if prevention of coagulation is occurred, then the result is bleeding. So adverse drug reaction or the higher doses of these drugs causes the bleeding, hemolysis, thrombocytopenia, and jaundice, etc. Now the clopidogrel. Similar mode of action to ticlopidin, irreversible blockage of platelet functions, safer but better tolerated than tocilizumab. Advantages over aspirin in ischemia: lower incidence of ischemic events, synergistic action with aspirin, prevention of ischemic episodes, kinetics, pharmacokinetics is product like ticlopidin, 50% absorbed orally. Adverse drug reaction, bleeding is the most common thing, then neutropenia, thrombocytopenia, etc. So uses of antithrombotics are here, like coronary artery disease, acute coronary syndrome, cerebrovascular accidents, prosthetic heart valves and arteriovenous shunts, venous thrombosis, peripheral vascular disease, etc. So you have to must know this heparin, warfarin, fibrinolytics, antiplatelet drugs like aspirin, dipyridamole, and clopidogrel.